Go.
Are you far back enough though?
Yeah, go.
Close up. Okay. All right. My name's Emily. I'm going to be talking about heart disease. All right. So you notice a mild discomfort feeling in the bottom of your chest that radiates pain off and on. You think, no big deal, it's only heartburn. Well, that's wrong. Suddenly the pain becomes more intense and your chest feels so constricted it stifles your breath. You are having a heart attack. This is due to a medical pathophysiology known as coronary artery disease, also known as heart disease, which is the #1 killer of men and women in America. Because I work in healthcare, I am exposed to the effects this disease has on its patients, and let me tell you, the road to recovery is painful and long. Therefore, knowledge and education are the most important keys. Today, I'm going to tell you what coronary artery disease is, the warning signs that precede a heart attack, and finally, how this disease can be prevented. In order to be able to reduce your chances of having this disease in the future, it is important to know what exactly the disease is. According to Donna D. Ignatavicius, I don't know how to pronounce her last name, and M. Linda Workman, authors of the textbook Medical Surgical Nursing, Patient-Centered Collaborative Care, coronary artery disease is a condition in which the arteries providing blood supply to the heart become diseased, usually by plaque formation, which reduces the amount of blood flowing to the heart. The lack of oxygen-rich blood to the heart leads to tissue damage, which ultimately leads to a myocardial infarction, which is another word for heart attack. If the heart is lacking oxygen, it can't pump blood to vital organs effectively, which can lead to more serious complications. Coronary artery disease can be subcategorized into many different heart pathologies, all of which are regulated by non-modifiable and modifiable risk factors. The non-modifiable risk factors are anything that you as a person are not able to control. These risk factors include age, gender, family history, and ethnic background. Those individuals with a family history of heart disease have an increased risk already for having it in the future. Men are generally at an increased risk for developing this disease until the age of 80, when women seem to develop it more so than men do. And this disease also increases with age as well. Modifiable risk factors are considered to be lifestyle choices that can be changed or controlled. These factors include obesity, hypertension, diet, physical activity, type 2 diabetes, tobacco, and alcohol use. Because people with CAD or heart disease are at an increased risk for having a heart attack, it is important to know warning signs in case of an occurrence. The staff at Harvard Medical School lists these signs and symptoms to look for: pain in the center of your chest that radiates to one or both arms, shortness of breath, cold sweat, nausea, unusual fatigue, indigestion, back pain, heaviness or weakness, and heart palpitations. It is important to mention that not all warning signs will be the same with each person. Some may have 3 or 4 signs, while others only have 1, and some may not have any at all. These symptoms may also appear over a period of time, or could very well be of rapid onset. If you may suspect any of these signs are occurring, call 911 immediately. The sooner care is received, the better the chance of survival. As we all know, prevention is key when it comes to inhibiting something from occurring. The American Heart Association provides guidelines to help aid prevention, some of which are: eat a heart-healthy diet, become more physically fit, limit the amount of daily caffeine intake, and avoid tobacco and alcohol use. When it comes to eating a heart-healthy diet, you want to eat foods that are low in saturated fats, trans fats, cholesterol, and sodium, and all of these substances are what actually block the arteries. An example of this would be to eat more fruits and vegetables, no greasy foods, and less intake of red meats. Since obesity is a major risk factor for heart disease, becoming more physically active helps to lose weight as well as help condition the heart as well. It is best to try to exercise at the same time every day, which helps for it to become a habit. And the exercise needs to be at least 30 minutes of moderate to rigorous intensity. And some examples of this would be bike riding, fast-paced walking, running, swimming, Limiting the amount of daily caffeine intake as well as avoiding alcohol and tobacco use will greatly decrease the risk for heart disease. These three substances help clog and aid in the deterioration of arteries. As we come to a close, let's reflect on how important knowledge can be when it comes to diseases. If we know what the disease is, the warning signs that may accompany it, and ways to prevent development, the chances of survival have already increased. Remember, heart disease is the #1 killer of men and women in America. Don't let the choices you make now affect your life later.